speak to you today. My name is Ed Klump. Look around the room here. I think most of you are familiar with me, so I won't go into my background and take your time to do that. I am here representing the Kansas Association of Chiefs of Police, the Kansas Sheriff's Association, and Kansas Peace Officers Association. Madam Chair, I want to tell you we appreciate the term non-advocate for today's speakers. Not to say that we're never going to be an opponent of a bill, but in this general discussion, we appreciate the opportunity to appear as a non-advocate, and appreciate that. Many of you have heard me speak before up here, and many times I talk about balance. And that is really what we're talking about here in this case, I believe, is balancing between what you are hearing may be a benefit and hearing what may be consequences, either known consequences that may be acceptable, or unknown consequences or unintended consequences. And we envy or we appreciate the position you're in making a very serious policy decision that can have ramifications, both good and bad, across the state. And those are not easy decisions to make, and it's not easy to sort out all the data that you're being flooded with to make that. This is a decision that we believe must be data-driven, and that's a term we hear a lot of anymore. And the problem with this decision being data-driven is we don't have a lot of really good data yet. We're starting to get some good data because of states like Colorado and others that have launched into this experiment. But the data is still, in some ways, a little fuzzy, although it's becoming much clearer over the last couple of years. And because of that, last week I spent 3 days out in Colorado at a conference that was put on out there by the Colorado Chiefs of Police on this issue. And I have to tell you, it's probably one of the best conferences I've been at because of the balance that was there. We had panels with people that operated the stores. We had panels with medical people. We had panels with the regulators who really didn't lean one way or the other, whether it should be or shouldn't be, but how do we deal with it now that it is? And we had panels with law enforcement. And all of the panels were very open. The law enforcement is at the point of, hey, it's here, now we got to make it work, what do we do? But most importantly, we talked about lessons learned. And what should other states be doing now in preparation for someday, maybe this happening in your state, or that's this year, next year, the year after. I mention that now because data is the #1 problem that they have found in almost all of these states. We don't have good baseline data when we want to drill down to a specific drug. Many times we have lots of drug data, but it's all kind of mixed together. And that's true in our law enforcement systems. We can tell you how many drivers got arrested for drug violations, DUI. I can't tell you how many were marijuana only. I can't tell you how many were marijuana mixed with other drugs, because we can't drill down in the data. And a lot of that is a limitation of our systems. Our systems really need to be updated so we can collect better data, have better baseline data, and then we can see what happens as things go on. Some things, a lot of what I'm going to talk about is the Colorado experience, and I want to just lay out some very basic things about Colorado's experience. They legalized marijuana for medical purposes in 2000. In 2009 was when they had the first dispensaries. So from 2000 to 2009, you could have a medical card. I believe, if I remember correctly, you could grow marijuana, and you could possess it, and you could use it as long as you had the medical card without penalty. In 2009 is when they opened up the dispensaries for medical marijuana. And then January 1 of 2014 is where they opened it up to what they call recreational use. That's a horrible term, but we won't go there right now. And so I just want you to keep those things in mind. The other thing about Colorado a lot of people don't realize is the legalization, the decriminalization happened across the state. If you have a medical card prior to January 1, 2014, and you possess marijuana, you were not criminally liable. After January 1, 2014, if you possess marijuana in the quantities allowed, then there's no criminal violation. But they also have a local option in this. When it comes to the dispensaries, the manufacturing processes and all those things, local areas could opt out of it. And so many of the jurisdictions did not go into this. About half the dispensaries are in the Denver area in Colorado. That was totally new to me, because I thought it was just statewide. And everybody told us, the regulators, everybody told us that one of the things that has proven advantageous is allowing that dual regulatory authority. And it's not duplicative. The state regulates certain things, the locals regulate certain things to make sure that they are meeting zoning requirements, they're meeting building codes and those types of things. They can even restrict the plants, the number of plants a little more. They can restrict what is in a house versus a manufacturing process. In other words, some houses you go into, they were telling us, we're just filled with marijuana plants. And you can have 6 per patient, or 6 per person under the new law. And obviously, how do you prove how many people own those plants? You can't. So it's just unenforceable. So that's a lot of what we talked about. The biggest problems that we learned they're dealing with out there is the edibles, which they told us is about 50% of their sales since the recreational use started. And one of the big problems is the way it happened in Colorado. Hopefully it won't happen in Kansas, but the way it happened in Colorado, there was no lead time to get all our regulations in place, get the studies done, make sure we're doing this right. It was, here it is, it's law, bam. Just the week before our conference, Colorado put into place the regulations on the edibles, a year into it. And that has caused an immense amount of problems. So that's one of the areas. The second biggest problem they've had is in the home growing, allowing growing the marijuana plants in the home. It's been very difficult to regulate. That's been around since 2000, and they've had many problems with that. And that's where the local building codes and zoning codes and things have come into place to try to help control that. Some of the problems they have with it is when they do the marijuana grows, apparently they like to have high humidity. That leads to mold growth. They showed us pictures where these marijuana plants are in rooms where kids sleep and things like that. There have been numerous cases of child endangerment because of the way that it's been handled. So those are the things we have to look at and ask ourselves, if we do this, then how do we control that so that we keep the kids safe and we do it in a reasonable manner and things like that. The testimony that I gave you, and I'm not going to go through all of it, but what I'm trying to do is draw together some of the key data elements that we were presented with out there. And I presented the source of these, and I am not an analyst. I'm not going to try to analyze the data that's merely presented to you, but you notice that most of it is prior to 09, after 09, and that's when Colorado saw a big shift in what was happening in Colorado, because that's when they opened up the dispensaries. And I'll just run down through some of those, and these are kind of in the order they're in the report here. But drug-related, and I want to stress drug-related, not marijuana-related, because their data, they couldn't separate that. But in the Colorado school systems, the drug-related expulsions and suspensions went up 15% after 09. The student drug testing, and I don't know how that works exactly, but the THC levels in that testing, this is primarily high school students, it's on your chart there, doubled. Although, interestingly enough, the number of kids kind of went down a little bit, but the THC levels went up. 12 to 17-year-olds, the one use within the last month was up. This one I thought was concerning. Ingestion by kids less than 12 was up. Pediatric ingestion was up 4 times. Fatalities. This was interesting because one thing we heard advocates out there tell us was, hey, traffic fatalities are down in Colorado since we did this. Well, traffic fatalities are down in Kansas too. Traffic fatalities are down in almost every state, whether they're legalized marijuana or not. But what they're finding in the data in Colorado is the number of fatality accidents in which testing shows marijuana on board of one of the passengers, in other words, in their system, has risen dramatically. So the number of fatalities are down, but the number with marijuana in their systems is going up. Marijuana-related hospitalizations up 66%. Exposure rates, and this is based on Poison Control Center calls, are up, and that chart in there is by age, and you'll look at that. Very young kids there's an increase in very young kids getting hold of this and then having those issues. One of the most alarming things, I think, for our profession is on page 10, and it has to do with the extraction labs. There's a process to extract the THC oils from the marijuana, and it uses flammable liquids to do that. Colorado in 2014, and this chart says 26, and you'll notice that was through June. Well, through the year, 31 explosions from this extraction process, and I think that's more than we probably had in any state from meth labs. A very concerning thing. 2 of those were hotels, where they were using hotel rooms and had explosions, and so that's a factor certainly to be concerned with, and make sure we have mechanisms to deal with those things. The black market for marijuana in Colorado, according to the reports we were shown, hasn't changed significantly, but there is now what's called the gray market. And if you'll remember in our discussions about methamphetamine and pseudoephedrine, we have the smurfers who buy the product legally and then convert that over to people that otherwise couldn't have it, and that's the gray market. And that gray market serves underage people, it serves out-of-state people, and it's a significant concern to law enforcement over there. Postal Service interceptions of marijuana being shipped out of Colorado have just skyrocketed, probably tenfold, if I remember the numbers right. So a lot of the information that Dr. Buff expressed, we heard out there. The medical marijuana licenses to the prescriptions that are written by doctors, and then you get a license. There's an application, and there's a license. A lot more applications than there are licenses. But prior to 2009, when they opened the dispensaries, those numbers were real low, and I don't have the exact numbers written down here, but they were down to less than 10,000. And the year after they opened the dispensaries, it was at 130,000. And today's numbers, 3% of the people holding a medical marijuana prescription in Colorado have listed the diseases that you commonly hear about marijuana will have. The other 97% are for pain and other things that aren't commonly considered. So it kind of supports what the doctor was telling me. I'm going to wrap up here. On the last page, I've listed some resources that some of this data came from. Senator Haley, you mentioned the HIDA report. I don't know which version of the HIDA report you have there. Is there a date on that one?
August 2014.
Okay, that is the latest one. And there's a new report that just came out last week from the Police Foundation. Police Foundation, although it has the name police in it, is not a police organization. It's an organization of professional people, most of them non-law enforcement, that study matters like this and give us some good information on dealing with various police issues. And that link to that is out there too. Also stuck in a little picture of some gummy bears for you there. One infused and one not. One of the things that I hear from law enforcement people a lot, if they can infuse food with this stuff, and what we heard out there in Colorado from the advocates was, well, that's a good way to ingest the marijuana for your medical purposes, because you're not smoking it, it doesn't bother people around you and things like that. Why can't we infuse the elements that help people into tablets, pills, capsules, like the doctor was talking about, through the pharmacy process, and do it that way where we have a proven methodology. So with that, Madam Chair, I will stand for questions.
Thank you. And I think we'll hold the questions because we have one more conferee. Kim Brown.